So I just want to appreciate or, give my appreciation to everyone for showing up today to get a little sneak peek preview before Advocacy Day is here at the end of the month. Also give some appreciation to our sponsors for Advocacy Day, CVS and Sumitomo. Appreciate or I guess not sponsors, but these folks have helped with the costs. So yeah, in this presentation, our plan for the day is to go over the goals of Advocacy Day, give you an idea of the schedule and logistics of the day, and then go over kind of how a general legislative visit should run, what specific asks we're going to be making, what we're advocating for, and then just some tools and tips and reminders to make sure everyone has a successful Advocacy Day this year. All right, so moving right along, this is the agenda for the day. So Advocacy Day, September 28th, we will be starting at the hotel for symposium. So that's the Hyatt Regency in Crystal City, right near the airport. So the actual registration and lunch is going to be starting at 11. So you all don't need to show up until 11. That Be Ready to Help is for staff members, actually. So yeah, starting at 11, come check in. We'll be doing box lunches that are catered by the hotel, so you can grab a box lunch. We'll all have you sitting in your advocacy groups, so you'll get your group number, which will be coming through email. That'll also get printed on the back of your badge. So you'll be able to sit with your group members, have some lunch, and then at 11:30, I'll be starting the training presentation, which should look quite similar to what you're going to see today. So you all are going to be extra prepared when it comes time on the 28th. And then around about 12:30 to 12:45, we'll be boarding the buses, making our way over to Capitol Hill and getting a lovely group photo in front of the Capitol building. And then by 1:30, we're going to be making our way over to the security checkpoint, getting through security so that everyone's on time for their first visit, which will start at 2. So the plan is for each group to have 4 visits between 2 and then wrapping up around 4 to 4:15, depending on how those scheduling logistics work out there. Then we'll be boarding the buses. There'll be a little evaluation for the day that you can complete online as we make our way back to the hotel. And then the plan is to get everybody back to the hotel by 5 o'clock so that there's time to kind of get back to your hotel rooms, have a little decompression break before the next symposium stuff is scheduled around, I want to say like 5:45 or 6-ish. So that is the plan for the day. So we'll start out here getting into more of the advocacy specifics, giving just kind of a legislative process refresher, for those of us who may have forgotten, or if high school government class is feeling awfully far away. Just a quick Civics 101 refresher so that we're all on the same page about how the legislative process works. And a fun thing, one of our favorite bills that's been around for a minute, the Safe Step Act, actually serves as a great example for all the points in this refresher. So I'm going to refer to that bill as I'm going through this legislative process. So starting with there's the 2 houses of Congress, there's the Senate side and the House of Representatives. Each one can introduce bills. Sometimes members of Congress will actually coordinate with colleagues from the other house, and they'll introduce bills that are basically the same piece of legislation in both houses simultaneously. So those bills are called companion bills, and they can sometimes move at different paces. So whichever bill gets passed first would then move forward into the other house, and it would take precedence from there. So that's actually the case for the Safe Step Act. It is a companion bill. It's been introduced in the House and the Senate. We are going to be focusing just on the Senate side in our visits on Advocacy Day, so you really only need to worry about the Senate version of the bill, but just for your information, it is also in the House as well. So now, because Congress has just so many bills to consider in each session, there's committees and then subcommittees. that get assigned different bills according to topic. So some are like health-related legislation or science or budget-related, that kind of thing. So the Safe Step Act was referred to the Senate Committee of Health, Education, Labor, and Pensions. And like I said, since we're just visiting the Senate side, you only need to worry about that one committee. So when a bill is assigned to a committee, the chair of that committee then puts the bill on the calendar to determine when the bill gets considered. And since committees typically don't have time to consider every single bill that is assigned, the chair's placement of a bill on the calendar can actually be kind of the deciding factor in whether a committee hears about the bill at all, and gets like the opportunity to vote on it, to move it forward. So a really good way to increase the odds that a bill will get considered is to get more co-sponsors. So if you have more co-sponsors on a bill, that's kind of an indicator to the committee chair that people care about this bill. So by co-sponsoring a bill, the member of Congress is kind of saying that like not only would they vote yes for it if it came to a vote, but it's like a stronger show of support to say, you know, hey, this legislation is important to me or important to my constituents, and I want to see it move through committee so that our House of Congress can vote on it. So the really great thing about co-sponsoring is that it's very simple for Congress members to make that happen. Their office staff will just call up the office of the legislator who introduced the bill, that's the original co-sponsor, and just tell that office they want to join as a co-sponsor. So when you're asking your legislator to co-sponsor a bill, it's really just as simple as one phone call from their office staff. So that's a very easy ask for you to make of your legislators. So for reference, the Safe Step Act right now has 34 co-sponsors in the Senate, which is out of 100 total possible Senate members. So that's over a third of senators, or right around a third, which is really great news for us. Obviously hoping with our Advocacy Day that we can increase those numbers even more, but it's definitely a popular bill, a bill that people have been hearing about. One of those reasons that people have been hearing about it is that it's been around for a minute. So Congress operates on a 2-year schedule. So each congressional session begins on an odd numbered year. So this January was the start of the current 118th session of Congress. And then bills have to get signed into law by the end of that 2-year session. So for us, by the end of 2024. So when a session ends, any bills that were not signed into law already have to get reintroduced at the start of the next session. They'll have to gain back all of their old co-sponsors. So that is what happened with the Safe Step Act in the past 2 congressional sessions. So this is feeling familiar for those of you who are at previous advocacy days. You are correct. All right, so we'll go ahead and move into the actual visits themselves. The structure of a legislative visit begins with introducing all the members of your group. You can give your name, kind of, you know, a few brief words of like what your professional background is with PH, you know, mention where you're from, especially if you're a constituent from the office. If you live within the state that that senator is representing, they'll definitely want to know that, because they take kind of what you're saying more seriously if they know that you're someone who has the potential to vote for that member. So then you'll have one person to explain kind of what PH is. Again, this should be brief. You want to focus more on kind of how PH affects patients' everyday living. Just a very simplified explanation of kind of what's causing PH symptoms. So this total intro section of like who everyone is and what PH is about should be taking right around like 3 to 5 minutes max. Then you'll move into the stories and asks section. So this is like the core of the meeting. And depending on the timing with your group, you should be planning to spend about like 12 to 17 minutes sharing personal stories and making those asks. This is probably going to take some pre-planning. That can happen day of. So just make sure that your group takes some time at some point before you get into those offices to kind of discuss what the 3 asks that we're using for the day are, and to decide kind of who's in charge of making the ask, who's going to share their story within each office. And like I said, it is best if the constituents for that office are the ones who are making at least some of the asks, doing more of the talking. So like each person should be getting a chance to talk when they are the constituent for their office, but not everyone will necessarily have a chance to talk at every single meeting, just depending on the size of the group that you're in. And then lastly, you want to be sure to leave at least like 3 to 5 minutes for questions and to say your thank yous at the end. Again, kind of depending on how timing is doing. You will generally have a facilitator with you who can also help you like keep track of time, kind of nudge the group along if things are getting a little bit bogged down or if it's getting close to time to leave the office. You definitely want to do your best to end the meeting a couple of minutes early, especially when meetings are scheduled back to back, which they likely will be in this case, just to give time to walk from one office to the next. And then also you want to be sure you know whether the office that you're meeting with has already co-sponsored the Help Copays Act and or the Safe Step Act. Those are kind of the two main asks that we have that have bills attached to them. You just want to kind of know whether this is going to be more of like a thank you meeting or a please co-sponsor meeting. And we'll be giving you that information within the schedule. So you'll be able to look and know about that. And then the main 3 asks that we're looking at, like I said, are the Help Copays Act, the Safe Step Act, and then we're also asking about improving patient access to supplemental oxygen, which is a kind of a broader ask, and that's going to be a little bit more of like an educational piece. There's not yet a bill associated with that ask, but you will be just kind of sharing your perspective on supplemental oxygen, which I know is a real kind of hot button issue in this community. So I think it'll be very powerful for legislators to be hearing from you all about that. So here's just kind of a sample schedule to give you an idea of what you're going to be looking at. So you see over on the left side there, it's got like the meeting time, the name of the staff person you'll meet with, the senator's name, contact information, the address of the office within the Senate buildings. So that'll be kind of how you know how to locate which office it is. And then there on the right side, that's the information about the senator's committee memberships, if they're relevant to your meeting. So like that Senate Help Committee, Health, Education, Labor, and Pensions, they'll let you know if that senator is a member on that committee, or for similarly for the Help Copays Act, if that bill's committee is, if they're a member of that one. And then it'll also, of course, list whether they are a co-sponsor of either one of those bills already. So you'll be looking on that side of your schedule to find out whether to thank the member or whether to ask them to co-sponsor. And then there in the middle, we have those photos included of each senator, just kind of on the chance if you might happen to spot them while you're in the office. If you do happen to see a senator present, definitely feel free to ask if they would have time to get a photo op with the group. Your facilitator can do that, but like if you notice someone, feel free to take initiative and like just be like, oh hey, we have a group of like healthcare professionals here. We're meeting, to advocate for our patients. Would you have time to take a photo with us? Generally, they would probably be receptive to that unless there's just a time constraint, but never hurts to ask. All right, and then next we've got some tips here on just having a successful visit. So we'll go through all of these. Definitely make sure that you're familiar with the 3 asks that I've been alluding to. I'm going to go over those in detail in just the next slides here. So you'll definitely get an explanation of that. And then, like I mentioned, it is helpful if you take time to plan ahead with your group. So just kind of assigning those speaking roles ahead of time so everyone knows who's going to be speaking. You don't really want to have a situation where like we're all kind of looking at each other and waiting for someone to speak up. And then definitely think ahead about what patient stories you have that might work well to illustrate the importance of the asks we're making on Advocacy Day. So in the next couple of slides, as I'm like going over these, just kind of have in the back of your mind, like, oh, this feels similar to like patient X's situation. Maybe I can tell the story about that person and how this legislation would affect this patient that I have. And you also do want to work on keeping your stories brief as well as your introductions. The meeting slots are about 30 minutes long, but you should really think of these as more like a 20 to 25-minute meeting max, because you are going to need time to travel between offices. Sometimes a staff member might be running late, just, any number of scheduling difficulties during the day. So plan for only speaking for about 20 to 25 minutes. And if you get a little bit extra time, bonus, but don't count on it. And then when you're talking about PH and the impact that these bills would have, you can definitely want to emphasize the PH community's reach. Even though we are a rare disease community, the process of like caretaking and everything with PH obviously affects a much larger group than just the individual patient. The caretakers, their friends and family, and as well as the healthcare professionals. You are also members of your patient's care team. We all are affected by these pieces of legislation. You can also remind them that they affect other disease communities too. Like, we're not the only ones who are affected by like benefit management's restrictions or challenges with copay assistance. So they are pretty wide reaching. You definitely also want to just be prepared for these meetings to most likely be with just the legislative staff. So don't take it personally if you're not able to meet with your own senators during Advocacy Day. That's pretty typical. So legislative staff actually, in a lot of ways, are better to be the ones that you're meeting with, because they are who's doing that policy research, and then they're bringing their recommendations to their bosses, who can then kind of decide how to vote based on that information. So if you're able to feed that information into the people who are providing those recommendations to the senators, that knowledge is kind of more likely to get remembered and there to be a record of it, versus just talking one-on-one with a senator who's possibly very busy and just has a lot of different priorities going on. So yeah, even if a staffer that you're talking with seems like very young, or you're just kind of like unsure about the situation, just make sure to be polite, take them seriously. They are the right people to be talking to. And just lastly, kind of make sure that you do actually clearly state the ask. Make sure the staffer knows what these asks are, and that this is kind of how they can help with the challenges that you're going to be laying out in your stories. And then, of course, make sure that you're taking the time to thank them for their time in meeting with your group as well. I see we do have some questions that came through, so I'll take a peek at those. Let's see. So Sherry asks, are you able to bring your purse/phone to Capitol Hill? Yes. So I will have some more detailed information about kind of the security process, just so I know what's like the most up to date. But yeah, for sure, purse, cell phone, that'll be fine to get through security, no problem. And then Lori asks, will someone be guiding us through so we don't have to navigate on our own? Yes, absolutely. We will have a trained facilitator with each group, whether that's going to be like a staff member, or we have a couple of like volunteer advocate facilitators as well, folks who've done this like many times before. But yeah, there will absolutely be someone who has experience with like navigating through the different Capitol buildings, and they will be guiding you. So you're not going to be left up to your own devices there. Someone else mentions they're taking the red eye, arriving at 9 in the morning. Is there a contact person at the hotel who can assist in early check-in to ensure storage of luggage? Yeah, called and asked with no success. Sorry about that also. I will check with our main kind of event organizer, but I would imagine that there should be. That's a great question. Definitely, I know for folks who are coming in really early the day of, we want to make sure that y'all have some time to like get prepped for the day. So let me ask about that, and I will kind of share that information with the broad group of all of the Advocacy Day attendees, because I'm sure other folks have a similar question too. So let me make a note of that. And then Sherry asks, is there a vegetarian option for lunch? Yes, there will absolutely be options that will accommodate everybody's dietary needs. We got those collected from you when you registered for Symposium as a whole, and this is absolutely tied into Symposium. This is not like a separate event. So we're for sure taking into account people's needs for vegetarian, vegan, gluten-free, whatever you need. We're going to make sure that there's an option available for you. Cool, really good questions. So thank you, everyone. Appreciate that. Keep moving along for now, but yeah, if anyone has other questions, please pop them into the Q&A. That's great. Okay. So for the asks, the first ask I'm going to go over is the Help Copays Act. So the full name is the Help Insure Lower Patients Copays Act, abbreviated to HELP. So this closes a loophole that some insurers have been using that basically kind of effectively lets them like double dip with their patients' deductibles or out-of-pocket maximums. So through this loophole, some plans have been accepting patients' copayments that are made through a third party, like a nonprofit grant, that are covering those copay costs. But then the insurance company is not counting those copayments from the third party towards the patient's deductible, since it wasn't the patient themselves who made that payment. If you think that sounds ridiculous, I agree with you. So once the grant money has been exhausted, which is typically for our patients usually happening like 5 to 7 months into the year, the patient is then kind of still on the hook for all those remaining months of copays that they have to pay because their own deductible was not getting paid down at all. So this makes those charitable assistance funds much less helpful to patients, because a lot of times folks are getting those copay assistance funds because they can't afford 1 month's copay to begin with. So definitely want to just tighten up that language in the ACA and make sure that that loophole is no longer allowable. So then for the next ask, the Safe Step Act, that I think probably a lot of folks have been hearing me talk about it because I know we've been pushing for that for many years, but I'll go over it just to make sure if anyone's not familiar. Basically, it's providing PH patients and their care teams with an option to kind of get around insurers' step therapy requirements, particularly when a healthcare professional knows that a certain treatment is not going to work, that the insurance company is wanting them to try first. So it's really useful when the patient has like already tried a therapy that didn't work while they were covered under like one insurance. And then if the patient has to switch plans or providers, this is a way to kind of get past that step therapy requirement faster. So if a patient is currently stable on a medication, this bill would provide this exceptions process where the insurer wouldn't be requiring the patient to go back through step therapy since they're already stable. So kind of a couple of things to note: if an office voices concerns about the Safe Step Act maybe giving patients like too much leeway, allowing overspending on like expensive brand names versus generics, I think a lot of y'all are going to be very well prepared to respond to those kinds of concerns. But just kind of an important thing to let legislators know is that specifically for PH treatments, even the generic versions are often just as expensive. And sometimes even more so depending on what kind of assistance is available. Some, more brand names have more assistance options for patients than the generics do. And also just because PH is a very nuanced condition, patients often don't respond the same to generics, even if those generics are, biosimilars. They're meant to act, just like the brand version of the medication. We know that in our case, that doesn't always hold true for our patients. So we want to emphasize that the PH patient's care team is the expert, and y'all should be the ones who are directing their care, not their insurance company. I do see a question has popped up. Oh, no worries. Thanks, Tanya, for popping in. Glad you made it in here. You'll get the explanation of the asks and stuff. And this is going to be, this is being recorded. So you will get a copy of this, of the full recording that you'll be able to access later on. That's going to be coming out with a know before you go email. So y'all will be getting this information in multiple ways. So not to worry. One other note around the Safe Step Act, if the office that you're talking with seems like especially engaged or genuinely like really interested in the bill, but they haven't quite gotten around to co-sponsoring it yet, definitely like make a note of that. Or, I mean, really we're directing your facilitator for your group to be making a note of that. Because then when I'm following up with the offices later, if I know that this office is especially receptive to the bill, then I have some more follow-up information that's like specific to that state that I can share with those offices. But I'm trying to limit that to only when it kind of really seems like worthwhile to give them those additional materials and information, rather than doing that for every single office up front, because some of them are just not going to necessarily be on board. Cool. So moving on to our third ask. There we go. Improving patient access to supplemental oxygen. Definitely a little bit of a big bucket category here. I know, I'm sure we can all talk for a lot of time about supplemental oxygen, but just a couple of kind of key points that we're trying to highlight. I guess, let me back up. So first off, there is no legislation yet for this bill. We've been, in contact with the Coalition for Supplemental Oxygen that's working on legislation. It's definitely like in conversation with various offices looking for that specific, right fit of a original sponsor to kind of be the champion of the bill. So far we have not found that yet. There's definitely some promising conversations happening, but for the purposes of Advocacy Day, we're going to assume until I hear otherwise that legislation is not ready yet. So we're just going to keep this ask number 3 as more of like an educational piece. So we're asking members of Congress to just kind of support legislation whenever it becomes available that addresses these well-documented problems with access to supplemental oxygen. So a couple of those pieces include we're advocating for a terminology change from home oxygen to supplemental oxygen, which is shifting the emphasis away from like the specific location where oxygen is used. Because patients who need oxygen therapy, we know that they shouldn't and often don't need to be restricted to their home. So the current terminology really paints an incomplete and limiting picture. Oxygen therapy honestly has the potential to be a resource that is actually freeing for patients and can allow them to be more active in their community, which, legislators should be on board with people being able to go to work and be, contributing to the community. So that's obviously provided that that our patients can access the equipment and the therapy type that is appropriate for their condition. So try to think about any cases where your patients don't have access to the right type of oxygen or are otherwise experiencing barriers in their daily life due to the form of oxygen that they use. Those would be great stories to highlight here. Another piece is the reimbursement structure for supplemental oxygen equipment. As it currently stands, there's no differentiation between modalities of oxygen. It's all just reimbursed at the same rate. So this has led to kind of a decline in the availability of modalities like liquid oxygen, which is more expensive, but can be a really good solution for folks who need high flow oxygen. And it's gotten to the point that PHA has heard from healthcare professionals that liquid oxygen is really no longer ordered. In some cases, it's not even like presented as an option in the system when they're trying to write a prescription. So we, are very concerned to hear about that change. And oxygen suppliers should not be the ones who are shifting patients off of one type of treatment onto another cheaper type of treatment. Oxygen is no exception. We've definitely heard of cases where that is happening. So we want to raise awareness with Congress, let them know that this is a problem and that needs to be restructured. Another piece is patients receiving oxygen need better support when they are first receiving their equipment, and ongoing support as well. So we want these reforms to include increasing patient access to specialist expertise. Specifically, it'd be great for that to come through the form of reimbursement for patient education of oxygen equipment use. So for healthcare professionals who are either coming into the home or at the hospital, actually getting reimbursed for their time when they're explaining how to use that oxygen equipment. Alrighty, that was a bunch. So I'm going to pause there for a moment just to see if anyone has any questions. And then if not, we'll move on to the last section of kind of tips and advice. All right, I see one question came through. Amy asks, do we need to bring any special forms of identification to enter legislative buildings? Also a great question. No, your just regular ID, whatever you use to get through, like onto the airplane, should be more than sufficient for getting into the congressional buildings as well. Yeah, thanks for that question, Amy. All right, definitely type in any other questions if you have them. Oh, I see Tanya asks, do we need to be concerned about safety? I'm assuming that's kind of a getting through security question as well. The security process shouldn't be really too burdensome. It's definitely gotten easier to get through security in like the past year or so. There's a lot less restrictions like COVID related. And, if you are more comfortable wearing a mask, you're certainly welcome to, but offices generally are not requiring that. Yeah, safety wise, I think just, kind of treat it similar to TSA. If you wouldn't carry it through TSA, you probably don't want to try to carry it into the Capitol building either. But I can kind of get some more specific tips and advice that'll come through with the know before you go email, just to make sure that you're all set and ready to go through security on the day of. There's also a question about when will we find out who is on our group to allow us to connect beforehand if possible, set roles. Yeah, awesome question. Yes, so the know before you go email is going to come out on September 21st, and then that's going to get followed up with a separate email for introductions and like a, just get to know each other email thread. So about a week ahead of time, you'll have a chance to email with people. If if your group members are amenable to it, if the scheduling works out, y'all can even try to have like a separate Zoom call ahead of time. I don't think that's strictly necessary, but it's an option that if you want it, it's there. But yeah, so you'll be knowing about a week in advance. All right, great questions. Thank you all. Cool, so we'll keep going along. Some potential questions that you might run into as you're going through these visits. If people ask about how many people in that state have PH, that can get to be a little bit of a tricky answer, to be honest, because it's just challenging to have an accurate number. And most of the numbers that we have like quick access to tend to be kind of underreported. So if there's a staffer who's like really curious about, well, how many people does this really affect in my state? Just refer those questions back to me, or make sure that the facilitator is aware of that question and they'll forward it along to me. We'll follow up afterwards with those kinds of specifics. As far as who is leading the legislation for the Help Copays Act, that's Senator Roger Marshall from Kansas. And then for the Safe Step Act, that is Lisa Murkowski from Alaska. So those would be the two senators who would be like the points of contact if anyone wants to co-sponsor. But again, that's probably more of a me question than it would be something that y'all necessarily have to like memorize. They're probably not going to be asking you to tell them that. And then if they bring up kind of copay assistance programs, tend to keep people on expensive drugs when they could be using a generic, just remind them there's sometimes not an equivalent generic for a brand name drug, or if there is one, those generic costs can still be extremely high and still be out of reach for patients who will still need that assistance regardless of whether they're on a brand or generic version of the medication. As far as the Safe Step Act, some offices have voiced concerns of that leading to increases in premium costs. But we actually have some great historic data based on the state level laws that are already in place. States have been doing this as early as 2015, and all the evidence from that suggests that it is not going to have any significant impact or increase on premium costs. And then lastly, this is not very likely, but if you do end up having a staffer who is just grumpy or not very receptive, kind of kill them with kindness, just put on your best polite face and make sure that they have no reason to have any negative impressions of PHA or the PH community. It's going to be what it is, and regardless, you showing up and educating them about pulmonary hypertension is still a good use of your time, is still going to go towards kind of bringing those offices to see things in the way that we want them to, even if that one individual meeting is not going to fully turn the tide. And then finally, just a big overall reminder, you do not have to know the answer to every question that is asked. Your job as advocates is to share your story, to create urgency around the legislation that we're asking about. So us policy experts are the ones who need to know that background information. I'm going to be following up with the offices for any questions that they ask. So just let them know that there'll be a follow-up email, and that'll be more than sufficient. All right. So lastly, just a couple of kind of reminders, tools for the visit. Like I've mentioned, there is going to be a packet with all the advocacy materials in that Know Before You Go email. It is going to include a recording of this presentation. I'll include these slides, so you can definitely refer back to them. That's going to be coming out on the 21st, so you'll have about a week to review those materials in advance of the day. I see Sherry asked a question. Do you have data on support to support projecting increase in the workforce numbers if supplemental oxygen were more widely available? That is a super great question. We definitely don't have the data right now, but I love that idea. So I will take a note of that. I don't know that I would necessarily be able to get that kind of data prepared for Advocacy Day, but I can definitely make sure to include something like that in my follow-up emails with all these offices. Yeah, good thought. Love that. And I guess as kind of an additional thought on that about, increasing workforce numbers, we don't necessarily have the data to back that up, but you can still absolutely share anecdotal evidence of that. So I've certainly heard stories about patients who have to get on oxygen, who end up needing like a high flow oxygen option, and they don't really have a good solution to get that other than just being homebound. So if you do have any of those anecdotal stories, you should absolutely feel empowered to bring them up and then also extrapolate from them. And, you can't say that this is absolutely true, but there are other patients out there with similar situations to your patients. So you can't necessarily put numbers to that, but just kind of broadly say, there are patients in our community who could be contributing to the workforce if they had access to this. That is true. And you don't necessarily have to have a number behind that to still share that piece of information with the legislators. Cool, great question. So a couple other pieces, as far as attire goes, most important thing is to make sure you are wearing comfortable walking shoes. It's definitely going to be a lot of walking. This is a 6-hour day, so just come prepared for that. If you're able to do it in heels, more power to you. I will definitely be wearing flat shoes, but just, know what you're getting into and dress appropriately. I guess aside from footwear, just in general for Advocacy Day closing, business to business casual is fine. If you want to go with like a polo shirt or a nice blouse with slacks, totally good. If you want to wear like a nice dress or a skirt or a suit and tie, also would not be out of place. Again, kind of go off of your comfort level, but kind of like a jeans and a t-shirt level is maybe a little bit too casual for this setting. So business to business casual. And then lastly, just one final reminder that the most powerful advocacy tool that you have is the stories that you are bringing from your patients. Those are really what's going to make your advocacy visits a success, and those are going to be the most compelling thing that we can tell legislators. So yeah, that is everything that I've got for y'all. I'll just close with this lovely photo from 2019 and share that I am so excited to be seeing you all in person so that we can have an updated photo of everybody in front of the Capitol building. I'll pause here for any other questions. Y'all have been asking a bunch of really great ones already. Cool. See another question. Oh, from Sherry. Thank you. Absolutely. Happy to share all this information. Appreciate everyone showing up. Yeah. Definitely you're able to send me an email if you have any questions that you think of in the meantime. But if not, I will be sending you all out more information on the 21st, and I look forward to seeing you in person in DC in a couple weeks. Awesome. Thank you all. Have an awesome rest of your week and safe travels.